Hey guys, welcome to the hip release. So this video is about if you're feeling sore in the hip or have a bit of hip displacement or just feeling junky, like what can happen is that the femur, this big bone here, okay, into the hip cradle, okay, the socket is just like this, okay, and it's meant to rotate and roll around. But what happens is part of life, or maybe a lot, you know, with like a lot of women as well, is that hips change after pregnancy, heaps going on. Anyway, what happens is that the femur, right, can just get jammed up inside the hip capsule. So all we're trying to do here is create slop and create some freedom, movement, and then the femur can actually roll around and we can have that looseness back inside the hip joint. And this here can feel junky, and some people can't get good flexion or maybe can't get into like good depth with the squat, and that's because the hip and the femur is actually just jammed up and tight. So what we do is we use a band, and I'd probably recommend using, like, say, maybe a heavier band. And if you're really strong, you can go the real heavy band. But this is ample. And also the note on this, I'll teach you how to do this by yourself, as I'm by myself in this video. Definitely easier with a partner for this video. But we just want to wrap this around the pole, and you want to set this up at about kneecap height. I don't know, I find that works pretty good. Wrapping it around just as I did then, just looping it through, wrapping it around. You want to make sure you pole something strong, right? And what you're going to do, it's this side, okay, that we're going to work on. This band we want to get right up high. Now there's nothing pretty about it. You want to get this high up into your crotch, okay, as high as you can. If you do not have this high up into your crotch, it's just going to then be very uncomfortable and start cutting into your thigh. So as high as you can in towards your crotch, and then you can use this pole so you can stretch across. Now you don't have to do it this way. You can always go back on, like, say, from this one on an angle, or an angle that way and shorter. Obviously more tension, more pull, okay, which the stronger you are, you might need more release. But from here in this video, this knee down, this knee up, straight away you can see that wants to try and pull my femur out, just looping it back. What we need to do, it's 3 seconds on, 3 count. So we want to work on, and we want to create tension this way, and for 1, 2, 3, release. 1, 2, 3. And then in this movement too, we want to take a big breath, and then as we pull on, and then we want to exhale, and then exhale, 3, 2, 1, and relax. Because the more I can get you to relax, then the more that then this band can actually then do its job of actually pulling the femur out of the hip capsule. If you stay tense and tight, it's not going to work. Now, as I was saying before, this is where a partner comes in handy, and we can create that tension of trying to then pull the band and really yank that femur, like you can see there in that video just here, like this, as I do this, really yank that femur out of the hip joint. Okay, so from here, let's go. So big breath in, and then breathe it out. And you might have to turn your knee and pull, 2, 1, good, relax. Now, if this isn't enough, you may have to stretch further, and you can use, like, say, a kettlebell or anything like that, and you may have to reach across more, okay, or on the floor, and then, and then from here, breathing in, and then boom, and then turn the knee further down. Because you're by yourself, turn the knee down, bang, 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 keep trying to turn the knee, pull, because at the end of the day, all you're trying to do is get this part of your femur to just release and pull out of this hip capsule just here, and then relax. Now, if you do one side, whatever you do on one side, always do the same on the other side. Okay, when you're exiting the band, big tip, try and grab the band if you're by yourself, loosen off that tension, just so you don't go and fly into that rack. I've seen this done, okay, before. Okay, so just ease off and don't just get yanked straight in. Guys, that's the hip release, okay? And take your time, don't rush. I wouldn't be doing it every day. You know, if you're feeling real junky in the hip, straight away. Also, I forgot to say, is like, do a test. Do a squat test at the start. So squat, see how much movement you have at the very start before you do this. Then do this on one side, like I just did then, and then do a retest, and then see and feel the difference. So that way you've got something to measure off, okay? And then my other note is I wouldn't be doing this every day. I definitely would only be trying to do this maybe just as like setting up a maintenance plan over like say maybe the next 6 to 8 weeks, and then after that, that's just like part of life. Twice a week, so maybe you do Tuesday, Thursday, you might do, you know, the hip release, where maybe Monday, Wednesday, you're taking care of more like upper body. But I'll build another video out with a schedule of what I think, you know, for like maintenance and working on different parts of your body. Guys, that's the hip release. Leave us a comment, give us some feedback. Talk to you on the next video.